National says the government ignored an urgent warning that the aged care sector would go into complete failure if something wasn't done about staff shortages.
The former DHB boss wrote to Health Minister Andrew Little warning of closures and now says his warning is coming true. Juliet Speedy has this exclusive report.
The final day of the New Zealand Aged Care Conference in Christchurch, a sector that the Chief Executive says is in crisis and tired of inaction.
Aged residential care is really struggling. We do feel neglected.
Given the state that the aged care sector is in, we need action now.
There is absolutely no doubt the aged residential care sector is in crisis.
The sector has over 1,200 vacancies for registered nurses or RNs, and that is 25% less than is actually needed.
And remember, in these facilities, often the RN is a sole regulated health professional caring for large numbers of people in their facilities.
We've got registered nurses who are working double shifts, sometimes triple shifts. They're really burnt out, they're really fatigued.
Chris Fletcher was the head of the Southern DHB and the lead chief executive for New Zealand's Health of Older People. In June, he wrote to the Health Minister to express his significant concerns. In the 3-page letter he wrote, "I feel it is my duty to be very clear with you as I believe all of the signs are present indicating imminent system failure. Unless some decisive actions are taken, I fear that there will be an acceleration of bed closures across the sector, an increased risk to patients and staff. My fear is that inaction is creating a race to the bottom. Closure of facilities and beds are biting. Facilities and beds have since closed."
The closure of more than 1,000 beds across care homes around New Zealand, and that's not a good situation for older New Zealanders.
National says the government ignored a desperate cry for help.
We see no actions that suggest that the Minister took any heed whatsoever of a very senior person across the sector representing all 20 DHBs.
The Minister denies ignoring the letter.
A letter from an advocate is not evidence of anything, it's evidence of a letter being sent.
And he's defiant.
So when you talk about a system collapse of the hundreds of thousands of people in retirement villages and so on, what is the system collapse you're talking about?
You can have your panel first.
The issues are nurse shortages across the board, exacerbated by less pay in the aged care sector, all made worse by New Zealand's immigration policy to attract more here.
Fair remuneration and the pipeline of both international and domestic nurses coming into the workforce and staying there.
If we were in government today, we would turn on the day one pathway to residency for international nurses.
But the government says it is addressing the problem.
Part of the immigration reset is about making sure that it's easier for that sector.
A sector that says it's been neglected.
And older people feel neglected. This is not just about our sector, this is about the old people we care for.
That's 40,000 New Zealanders who don't have enough people or places to look after them. Juliet Speedy, Newshub.